Hello, my name is Savannah and I'm an athletic trainer for the Auburn University gymnastics team. My athlete, Samantha Serrero, she suffered from an injury a few months ago while she was doing her floor routine at the NCAA regional semifinal meet. She dislocated both her knees and suffered from multiple torn ligaments. So while reviewing the footage, you can see that she was doing a front handspring double front pike. And in the skill, you need to lock out your knees. And due to under rotation, she was not able to land correctly, and it resulted in her injury. The force of the landing was sent up through the backs of her knees, which caused bilateral dislocation of both her kneecaps and tearing of both her PCLs, LCLs, and ACLs, and most likely minor tears in her hamstrings. Some signs and symptoms is that when looking at the footage, you can see that she hyperextended her knees about 90 degrees. There was guarding, her kneecaps appeared to be out of place. She heard a pop, which suggests completely torn ligaments. And one of her legs was slightly rotated out of place below the knee, and swelling and bruising around and on the area of dislocation. So she was unable to stand or walk, no movement of the leg below the knee, and due to nerve damage, she was not able to move her toes, and there was absolutely no weight bearing. So some tools that I would use to check for this is an x-ray to get an image of the dislocation and check for any broken bones, which she did not have, and an MRI for imaging the ligaments. So the first step when doing her initial assessment is I would do scene survey. So since she was doing her floor routine, there was nobody else on the floor at the time, so it was safe for me to proceed and safe for her too. During the immediate care, I would check her ABCDEs. So A, not as important, but make sure her breathing is normal. She has no weird sounds in her breathing. Next would be breathing, to check her respiratory rate, how fast is she breathing, and her O2 saturation, which would be a little bit difficult to do on scene right now, but it's something to keep in mind. Circulation, so I would probably check her popliteal pulse, which is right below her site of injury, to make sure there's still blood flow getting there, and since that's right next to her site of injury, I might also check her dorsal pedipulse, and then check brachial and or radial to get a more accurate reading. Next would be blood pressure. Check her blood pressure real quick. Disability, is there any altered mental state? And exposure, what is her temp and what is her pain scale? She had a pretty high pain scale of a 9. So the next course of action would be CMS, which I already kind of did. There's no movement of the toes. Circulation, check if there's any circulation getting down there. Is she able to feel me touching her toes? Next course of action would be to implement pain medication. Get her legs in some splints and completely immobilize them in order to move her off of the floor and get her to emergency surgery. So long-term care, since she does need surgery to get her knees back into place and repair any nerve damage that can be salvaged, she would probably be looking at a lot of rest and recovery before actually moving into the rehabilitation phase. So a lot of stabilization, medication, elevation, and ice to try and reduce as much swelling as possible. Next would be the acute phase. So this is when you want to move into restoring movement as soon as possible. So passive range of motion and isometric strengthening. So this could include me as her athletic trainer bending or straightening her knee to try and get some range of motion back, or sitting at the edge of her bed and trying to lift up her leg and hold it for a few seconds against gravity. Next would be subacute. So this would be more active range of motion and eccentric movements. So this could look like Samantha laying on her back and trying to bend and straighten her knee against gravity, or sitting at the edge of her bed trying to slowly bend and or straighten and bend back down as slow as she can. So this would probably be the longest phase for her since she did suffer a lot of nerve damage. And so the next thing would be to try and bear weight. So sit at the edge of her bed, try and put some weight on her legs, or using 2 poles on each side and trying to take little steps, using crutches, and eventually being able to take a few steps with assistance. Next would be the remodeling phase. So this is when she's able to bear weight, but you're trying to get her strength back up. So this could be holding a squat position or doing hamstring curls against, like, my hand if I hold her leg down and she has to try and do some hamstring curls. So this is going to help get her balance back. This is also a time to introduce some modalities like mobilization by me, or electric energy to stimulate the nerves, or ultrasound, which adds no pressure, but it's going to stimulate her tissues. And so this phase is extremely important to continue her neuromuscular control. So maybe kicking a ball, connecting her visual with her motor, being able to kick it. Next, so Samantha is not returning to sports, so these exercises will progressively get more rigorous in order just to get her back to typical function. So some things that I would avoid is in her rehab not making things too difficult for her. If it's beginning to wear her out or degressing her, then I would make it a little bit easier so that she's still progressing. So she is never returning to play due to her nerve damage. But if she was, I would have to see a full recovery of her torn ligaments, hamstrings, not only being able to bear weight, but able to handle high impact, and then complete nerve control comeback. And so with Samantha's injuries, that was not possible. So I would not clear her for sport because her nerve damage and high level of strain makes her incredibly susceptible to another injury, especially in a rigorous sport like gymnastics, where being able to handle impact is